Hi, this is Justin Coyle, and I'll be discussing causal risk analysis. This presentation is for the class on Information Systems for Healthcare Management, taught by Dr. Alemi at USF. It is based on the 26th chapter of the Handbook of Healthcare Delivery Systems. This chapter is titled Causal Risk Analysis and was written by Farrokh Alemi and Manaf Sargoush. Causal risk analysis is a type of risk analysis that takes into account relative causal models. This chapter examined the incidents where Vioxx was said to have caused excess cardiac events. Probabilistic risk analysis was started in the space industry in 1967. It was used as the standard approach for analyzing the risks involved with the shuttle flights. It has also been used in many other industries. Some examples include assessing nuclear reactor safety, preparing for cyber terrorism, earthquake predictions, floods and coastal design, environmental pollution, waste disposal, and environmental health. Application to the healthcare setting has been less common, but it has been used in the analysis of allergic reactions, medication errors, falls, and infant mortality. Probabilistic analysis has evolved into causal analysis in recent decades. One of its earliest applications was to understand the impacts of environmental pollutants. The application of causal analysis to risk analysis is still rare. To apply causal analysis, we first need to understand what is a cause. To clarify what a cause is, we need to be clear about what an event is. Events are physical or mental changes that have a definitive start and end. Causes link events to each other. They are temporary events. We would also expect causes and effects to be associated with each other. This association could be measured using correlations, conditional probabilities, or other methods. It's important to note that a cause is not always deterministic. A cause doesn't always lead to the same effect. Causes describe a mechanism where one event leads to another. A series of events can cause each other until an effect ultimately emerges. The original event would be called the root cause, and the event immediately preceding the effect would be the direct cause. Causes, obviously, always precede the effect. If an event happens after the effect, there is no way that event had a causal relationship with the effect. If one event is said to have caused another, the counterfactual must also be true. So if an individual has an effect happen to them, that effect would not have occurred if the cause hadn't already happened. If an effect can occur without the event, that event can't be said to have caused the effect. For example, if we're going to say that Vioxx causes excess cardiac events, we have to show that these excess events wouldn't have occurred if these patients were not taking Vioxx. This is an example of a causal diagram. This shows that a patient's arthritis pain leads to a prescription for Vioxx, which in turn leads to reduced pain, but also increased cardiac events. Each arrow shows a cause and effect relationship. The absence of the arrow tells us that there is no cause and effect relationship. In this diagram, we can see that Vioxx causes cardiac events. However, there is no direct link between arthritis pain and cardiac events. These are independent events. Arthritis pain does not cause cardiac events. Probability networks take a step beyond causal diagrams to assign specific probabilities to each cause. This diagram shows a series of events that can be organized into a probability network. They cannot model causes that feed into themselves. In this case, poor care leads to lower market share, which then leads to lower volume and less practice. This lack of volume and practice leads to even poorer care, and the cycle continues. This diagram shows possible causal relationships among three events. The diverging structure occurs where one cause leads to multiple effects. A converging structure occurs when two causes leads to a common effect. and the serial structure depicts a series of events that leads to an effect. The cause that occurs first is the root cause, and the cause immediately preceding the effect is the direct cause. This diagram depicts a situation where a patient has died from one of two separate and independent causes. If we know that the patient has died and there was no cardiac event, it is likely that they have died from the other cause. The discussion on simultaneous equations will be based on this diagram that depicts how Vioxx leads to excess cardiac events. The equation shown here says that mortality is a function of patients with cardiac and other diseases. This next equation shows that cardiac events are a function of the patient's severity of cardiac illness and the use of Vioxx. This equation will show us what percent of cardiac events can be contributed to Vioxx. This equation states that the frequency of other diseases is a function of the severity of other illnesses in the patient. This last equation links the use of Vioxx with the level of pain among patients with arthritis. If we solve for all of these equations simultaneously, we can determine whether or not Vioxx has led to increased mortality.